Om Swastiastu. Hello, we are from Small Group Discussion BA. Thank you for the opportunity and the time. And now we will presenting our student project entitled Problem Base of Antibiotics Prescribing. This is our group members. And next, it will be explained by our friend.
Hello, my name is Sabrina, and I will start the explanation with an introduction that is about problem base of antibiotic prescribing. First, we should know what are drugs and prescribing. Drugs are all kind of single or mixed substances that is used by all living creatures in the world, human and animal, on the outside or inside of the body parts to prevent, lighten, and heal the specific disease. As we know, there are so many kinds of drugs in the world, traditional one and modern and more various categories. One of them is antibiotic. So antibiotic is a chemical compound that is used as a resistor or bacteriostatic and as a crusher of bactericidal for the specific bacteria or other microorganism. And what is prescribing? Prescribing is writing a drug or some drugs on a paper for the pharmacy with a specific dosage and consumption time for a specific disease based on diagnosis of the patient. And antibiotic prescribing is making a receipt of an antibiotic to for the pharmacy. So the pharmacy will give the certain antibiotic for the patient to prevent and destroy the specific bacteria. So who will do the antibiotic prescribing? The answer is doctor. So because the doctor is also a human, there will be so many errors are making a receipt for the patient.
My name is Doi Putwai Sakaraja Serikanini, and I will continue the explanation about the background, problem formulations, objectives, and benefits of our student project. Prescribing errors have characteristics that when the patient is not healed after consuming the drugs based on the receipt, or there are side effects and harm to the patient. The problem formulations of our student projects are: what is antibiotics prescribing? What are the problems that can occur in antibiotics prescribing? What factors affecting antibiotics prescribing occur? What are the side effects of antibiotics prescribing errors? And what is the appropriate way of prescribing antibiotics? While the objectives of our student projects are to describe the meaning of antibiotics prescribing, to describe various problems that can occur in antibiotics prescribing, to describe factors affecting antibiotics prescribing errors, to describe the side effects of antibiotics prescribing errors, and to explain the appropriate way of prescribing antibiotics. And the benefits of these student projects are to add library references and broaden knowledge about antibiotics prescribing and the appropriate way to prescribe antibiotics.
Thank you so much for the opportunity. My name is Leopoldo Amrena, and I will explain about antibiotic prescribing. So, antibiotic use is essential in medical field. They work by killing the bacteria and prevent the bacteria from spreading out. Antibiotics are not only used for treating bacterial infections, but also for prevention and dealing with several complications. Antibiotic prescribing is vital and became base treatment for infection for ages. The antibiotics are prescribed by doctors due to some important factors such as uncertainty of diagnosis, fulfilling patient expectations, sustainability, financial reasons, external influence, and knowledge development. Even though the use of antibiotics is known as the most effective path to deal with diseases related to bacteria, the side effect cannot be denied. The use of antibiotics can also increase the probability of antimicrobial resistance or AMR happens. Thus, it is important to make sure the antibiotics are prescribed correctly.
Hello, my name is Kadep Pamniaga Sakana, and now I will continue the presentation with problems in antibiotics prescribing. Prescribing medication is a risky activity within healthcare, as there is always the potential for side effects. Prescribing mistakes are common, affecting 7% of medication orders and 50% of hospital admissions. However, These mistakes do not always lead to clinical harm. Antibiotic overprescribing has been found to increase patients' relapse potential, as they are more likely to become a medical case due to it. The overuse of antibiotics can lead to adverse effects for patients. Antibiotics are used about 20% of the time when people need emergency medical help, although nearly 80% of antibiotics prescribed for infections are due to allergies. Some common prescription antibiotics can also cause gastrointestinal, nervous, and mental disorders. A research conducted by Limato et al. About views and practice regarding antibiotic prescribing and stewardship among hospital physicians in Jakarta, Indonesia suggests that nearly a quarter of respondents indicate to be often unsure if a patient needs an antibiotic or not, or which antibiotic to prescribe. A small but considerable fraction expressed lack of confidence in prescribing decisions, prescribed in patients with just a high fever, when they felt uncertain about the diagnosis of infection, prescribed more freely because of fear of clinical failure, and frequently prescribe antibiotics because patients or their relatives insist it. That's all from me. Thank you, and my friend will continue the presentation.
Thank you for the opportunity. My name is Tiana Ningrum, and I will continue the explanation about the problem. A research conducted by Limato et al. About views and practice regarding antibiotic prescribing and stewardship among hospital physicians in Jakarta, Indonesia, suggests that nearly a quarter of respondents indicates to be often unsure if a patient needs an antibiotic or not by 23.6%, or which antibiotic to prescribe by 21.3%. Antibiotic resistance has several side effects. Side effects of antibiotics that affect the digestive system include vomiting, nausea, diarrhea, and so on. 1 in 15 people have an allergic reaction to antibiotics, especially penicillin and cephalosporin. Most often, allergic reactions include an itchy rash or urticaria, coughing, wheezing, and a feeling of tightness in the throat, which can cause respiratory distress. One example that often occurs in Indonesia is for mild respiratory cases, which are often thought to be caused by germ, so that most cases or 90% cases receive antibiotic, with the most common being tetracycline. Another antibiotic that is often prescribed in Indonesia is amoxicillin syrup, which causes side effects in the form of urticaria by 13.72%, headache by 1.96%, and nausea by 1.96%. In rare cases, antibiotics can cause a serious and potentially life-threatening allergic reaction known as anaphylaxis. The initial symptoms of anaphylaxis are often the same as mild allergic reactions. These include being crazy or fainting, having difficulty breathing, and so on. For example, rapid shallow breathing, wheezing, rapid heartbeat, sticky skin, confusion, and anxiety.
My name is Nathania Faustin, and I will explain about factors affecting antibiotics prescribing. The first factor is clinical situation. Clinical situation and the patient's medical history are essential considerations for doctors before deciding on an antibiotics prescription. Lack of communication with patients or absence of common clinical signs and symptoms could lead to a hazy clinical situation and misdiagnostic. Thus, doctors could either promote or impede inappropriate antibiotic use. Next, underutilization of diagnostic resources. The degree to which doctors could use diagnostic resources is finite. It is either caused by lack of time, skills, and equipment, heavy workload, or financial problems. As a result, doctors have fewer supporting data to diagnose patients. Be that as it may, diagnostic uncertainty and antibiotic prescribing errors could occur regularly. The third one is influence of others. The opinion and wishes of other healthcare professionals or patients' families might affect how the doctor chooses to prescribe antibiotics. It occurs as it influences the extent of uncertainty confronted by the doctors while treating patients. Next.
My name is Tiffany Cecilia, and now I will continue. So far is influence of the environment. It covers the term of evidence availability, diagnostic research accessibility, and medical information attainability. Insufficiency of prescribing guidelines and insight into local resistance patterns would entangle the treatment decisions that would eventually complicate the antibiotic prescribing process. 5 is systematic error. When it comes to the term with antibiotic e-prescribing, system error is considered to promote antibiotic e-prescribing error. System error covers the drop-down menu, antibiotic database, and frequent chasing events. 6 is user-related errors. It was an undeniable fact that some healthcare professionals might show a lack of information technology skill. The most reasonable defense was that particular healthcare professional did not take part in workshop or regular training on the e-prescribing system. Next.
Thank you for the opportunity. My name is Zefania Rindi, and I will explain the side effects of antibiotics prescribing errors. So all prescribing procedures are error-producing steps. A prescribing error can result from selecting the incorrect drug, the incorrect dose, the incorrect route of administration, and the incorrect frequency or duration of treatment. It can also result from inappropriate or erroneous prescribing in relation to the characteristics of the individual patient or coexisting treatments. Antibiotics do save lives, but poor prescribing practices expose patients to significant consequences, including avoidable allergic reactions, highly resistant infections, and deadly diarrhea. Prescribing errors also contribute to the development of antibiotic resistance, making these medications less likely to work in the future. Next.
Thank you for the opportunity. My name is Rose Velani, and I will now explain about the example of antibiotic prescribing error side effects. The most common antibiotic prescribing error is blend prescribing, in which antibiotics are prescribed without any culture or sensitivity testing. Blend prescribing not only contributes to antibiotic resistance, but it can also make diagnosing patients more difficult. Other errors include tetracyclines prescribed during pregnancy and breastfeeding, which may cause dental discoloration in the child. Next is trimethorphan used without folic supplementation during the first trimester of pregnancy in the woman at risk of folic acid deficiency. This condition increases the risk of congenital malformation due to trimethorphan folate antagonist effect. Another common antibiotics prescribing error is inappropriate dual prescribing. For example, patient that has been prescribed comoxiclav, which is two penicillin-based antibiotics, thus increase the risk of adverse effects. That's all from me, and now the presentation will be continued by my friend.
My name is Nanita Nas, and now I'll explain about the appropriate way of antibiotics prescribing. According to the CDC, appropriate antibiotic prescribing means that antibiotics are only prescribed if they are needed, so when they are needed, the right antibiotic is chosen and prescribed at the right dose, also for the right duration. Antibiotic selection is mostly determined by the patient's infection and the bacteria that cause it. Here are other factors that influence antibiotic selection. The first one is severity of the infection, health of the patient's kidneys and liver, dosing schedule, other medications the patient may be taking, typical side effects, a history of an allergic reaction, if the patient is pregnant or breastfeeding, infection patterns, and antibiotic resistance pattern in patient's community.
Thank you for the opportunity. My name is Natania Catherine Sutaya, and I will continue to explain about the appropriate way to prescribe antibiotics. In order to prevent global antimicrobial resistance, antibiotics prescribing can be assessed with antimicrobial rationality assessment tool. This assessment tool has been evaluated within diverse educational backgrounds with 68.6 until 80% agreement with experts in the assessment based on the specificity and sensitivity. It has been discovered that the most common mistake that increases the irrational antibiotics prescribing rate is the incorrect dose of antimicrobials given. And this is the antimicrobial rationality assessment tool to determine whether the antimicrobials prescribing is rational or not. It consists of several questions that is related to the prescribing, like the reason for antimicrobials therapy, the investigations that has been done, and whether the right choice, dose, method of administrations, and duration has been prescribed. The next part will be continued by my friend.
Thank you for the opportunity. My name is Remal Prabudianto, and I will convey about the conclusion of our student project. Prescribing errors affect about 7% of medication orders and 50% of hospital admissions. Antibiotic prescribing errors are the most common than prescribing errors in other types of inpatient medication. It can lead to some consequences such as drug allergies, highly resistant infection, lethal diarrhea, vomiting, antibiotic resistance, etc. These errors may be caused by clinical situation, underutilized diagnostic resources, influence of others, influence of the environment, system errors, and user-related errors. Most common antibiotic prescribing errors is blind prescribing, where antibiotics are prescribed without culture or susceptibility testing. According to CDC, the appropriate way in prescribing antibiotic is by prescribing only when needed at the right dose for the right period. That's all, thank you.
My name is SGD Nathan, and I will tell about advice according to this topic. Before prescribing antibiotics, doctor must calculate all the risks and benefit for the patient. Even when doctors already count them, errors in antibiotic prescribing often occur, such as overprescribing, errors in system, and prescription misunderstood by the pharmacist. To minimize this problem, doctor must have the most recent knowledge about drugs and utilize existing tools such as guidance to reduce antibiotics prescribing errors. This is our reference. And now we are at the end of the presentation. We would like to apologize about our mistakes, whether it's intentionally or unintentional. Thank you for the attention. Om Santi 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 Om.